Over 36 million Americans wear contact lenses, but if you don't wear them correctly, they actually may be causing more harm than good. And our next guest, Micah, has been wearing contacts for years and recently developed an unexpected problem.
I started wearing glasses in first grade. I'm incredibly nearsighted. I have to hold something probably like 3 inches from my face to be able to actually make it out clearly. I started wearing contacts in 8th grade. Almost right away, I started sleeping in my contact lenses. I've actually left my contacts in for as long as a month without taking them out. My eyes kind of get red and irritated. My regular eye doctor sent me on a referral to see Dr. Assil to see if I was a candidate for LASIK surgery.
We'd like the thickness measurements of your cornea to be a good 10% thicker than yours is. So LASIK's not the best procedure for you. The best procedure for you is a procedure called the Verisyse. It's a lens that fits into your eye in the empty space between your outer lens called the cornea and the colored part of your eye called the iris. The Verisyse procedure is much better for a patient like Micah who has both high nearsightedness and thinner corneas. He tends to leave his contact lenses in 24/7. There's a great danger in that. The risk of blindness goes up 20-fold from infection because the corneas need to get their oxygen directly from the air. So sleeping with the contacts is a terrible idea. And so the Verisyse procedure is going to be a savior for him.
And let's see how the procedure went.
What we'll be doing for Micah today is implanting a new additional lens into his eyes. Look way up high, this way. Good, close your eyes now. We're making some marks on the outside of where we want our entry sites to be and also our reference points for how we want to center the lens later. So we're making our main entry site now where the lens itself will go in. Now here's our lens itself. It's hard to imagine. This tiny little piece of plastic right here is going to transform his whole life. Lens is going in right now and we have it inside. Now we want to position it properly. Beautiful. Just like that. I'm going to seal your entry site now with the stitches that are invisible to the naked eye. And these are dissolvable too. Fabulous. We're all finished with this eye. Good, you did magnificently. Good job.
I can actually see pretty well out of my eye already.
Now we're going to start treating the left eye, having gotten the result we were wanting for the right eye. So the lens has been clasped into position on both sides now. And the next thing to do is to seal our entry site. Look down, keep looking down. Good, all done. Congratulations. You're off to the races, buddy.
So I'm here with Dr. Kerry Assil and his patient Micah. Thank you both. And tell me what I should tell our viewers not to do.
Don't sleep in your contact lenses.
Thank you. So his corneas had literally thinned from wearing his contact lenses sometimes for a month at a time.
His corneas were thin and his eyes had become dry because when the contact is constantly in there, the inner lining of the eyelids, which produces a lot of the baseline tears, those cells get damaged and so you get progressive drying also.
So LASIK was not a good procedure for Micah. But explain why this procedure was.
If you look at the eye itself, if we take this schematic of an eye, and if we take it apart, the eye is really somewhat like a camera. It has a fixed focus lens on the outside, and then on the inside is the zoom lens. Behind the pupil where I'm poking my finger is the lens that sits inside the eye, the zoom lens, that as we get older develops cataracts. In LASIK, we reshape this outer lens. We reshape the lens out here to change its shape so that the light will focus better onto the retina, which is in the back of the eye, and then the nerve that connects the eye to the brain. With the Verisyse procedure, we take an entirely different approach. What we do there is we take advantage of this little empty space in here, and we slip the lens right in there, and then the lens clasps onto the colored part of the eye, the iris, so that it doesn't float around.
And so that gives him a little bit more of a more powerful effect than just pure LASIK would. And your vision, is his vision?
It's perfect. It's been
2020
since the next day.
You're loving that, aren't you?
It's been amazing. It's life-changing.
Well, so glad that you could come on our show and share it with us. Dr. Assil, it's always a pleasure.